Thank you, Emily. In today's health segment, we're exploring the risks and potential dangers of asthma in kids. With the summer sun and warm weather comes more outdoor activity and increased chances of asthma patients being affected. Joining us now from Delaware Pediatrics is Dr. Lana here with some advice to live by if you are suffering from asthma. Now, I have to say this is a topic that I'm very familiar with. My sister growing up suffered from asthma, and I have to say it can be quite the challenge for both the person afflicted and the parent. So what forms do asthma usually take when people are noticing that their child might be suffering from it?
Well, it's not surprising that you have a relationship with asthma because asthma is the most common chronic condition of childhood. There's over 6 million children in the United States with asthma, so about 1 in 12 children will have asthma. Asthma can be mild, can be severe, can be chronic, can be intermittent. It's a very heterogeneous condition, so it's not a one-size-fits-all. But there are some things that all children and all individuals with asthma have in common, and that is that they generally have triggers. So it's very important, if you've been diagnosed with asthma, that you know what your triggers are. For example, secondhand smoke and even third-hand smoke are major triggers to bring out asthma. Pollen, so right now it's spring, the pollen counts are high. In the fall, when ragweed season hits, pollen counts get high. Those are common triggers. Animal dander can be a strong trigger, particularly cats. Dust mite, fumes. There's all kinds of respiratory irritants that can trigger asthma. And in fact, we're seeing an increase in the rates of asthma, probably having a lot to do with air quality, environmental issues, and it's disproportionately higher in inner cities. So African American children, Hispanic children are having more asthma attacks. Asthma is probably the most common cause for visits to the emergency room, to the hospital, and to my office. So, number one, know your triggers, and to the extent that it's possible, avoid those triggers. Number two, know your medicines, and all children that have asthma should have at least 2 classes of medicine, a controller class and a rescue class. So the rescue class gives you quick relief when you're having symptoms, but doesn't last very long and doesn't prevent symptoms. So the controller medicine is really important because that will prevent symptoms, and both should be used as directed by your doctor.
So for people out there that have sort of controlled their living arrangements inside and they're starting now to go outside because of the warm weather, and they're talking about that rescue plan, where can they find more information, or how do they start to develop what's going to happen in case of an asthma emergency outside?
Right. So everybody should have an asthma action plan. And if you go to the Children's Hospital website, wchob.org, and find the Lung Center tab, you'll see the asthma action plan. You can download it and you can have it. You should discuss it with your doctor, but this prepares you on what to do and when to do it and when to contact your doctor.
Now, I can imagine these action plans are always specific to the person suffering from asthma, but, you know, on a general level, what do these typically include?
Well, they include avoiding the triggers, using your controller medicines, and appropriate use of your rescue medicine. What I should add is that the Asthma Action Plan was a collaborative effort that included input from the Buffalo Pediatric Society, the Children's Hospital, and the specialists at Children's Hospital, so the emergency room, the critical care people, the respiratory therapist, the lung center, the allergist. Everybody contributed to this plan. Everybody signed off on it, the community and the hospital, so it's a really good plan. I really encourage parents and children with asthma to visit the website, look at the plan, discuss it with your doctor, and follow it.
And one more time, what is that website for people that are watching and want more information?
wchob.org. Find the Lung Center tab, and in the Lung Center tab, you'll see that the Asthma Action Plan, there's a button that you can download it.
All right. Well,
but most importantly, discuss it with your doctor.
All right. Well, thank you so much, Dr. Lana, for coming in.
My pleasure.
And we'll make sure that we post all of those links when we post this to our website.